Hello, Chiropractic First of Rockford. This is Dr. Jake. I wanted to touch base on chronic knee pain. I see a lot of patients that come up with chronic knee pain and don't have a clue of why or when it all occurred. It just kind of developed and it hasn't gone away. And I'm going to shed a light on what the knee is, how it operates, and what we could do about chronic knee pain. So the topic is becoming unhinged. So a door, if you open up, it has three hinges on it. You open up a door, it goes open and close. That's all it does. It doesn't go sideways. It doesn't go up, down. It just opens and closes. Now, if those hinges are off centered or bent, then it's not going to be as effective opening and closing. The same thing happens with the knee. It's a hinge joint, which means it literally goes back and forward. So the knee is a stabilizing joint for both the ankle and the hip, which are very mobile. Now, when I look at what could go wrong with the biomechanics of a knee is with any twisting or angleization of that knee is going to cause stress on either one side or the other. Now, the root cause of that could be a lot of different things. It could be lack of range of motion in the hip, lack of range of motion in the ankle. However, what I like is I like low-lying fruit. I like things that are simple and easy to take a look at. And this is something that we do every day in the chiropractic office is look at hips and how level they are. Now, we don't pay attention to them at home, or at least patients don't, as much as coming into the office and recognizing that when we do get adjusted, or when you get adjusted with the hips, usually the low side of the hip is getting adjusted. Those are the drops that you feel when you come into the office. Now, you got to think of this in three dimension though. If the hip is lower, it's also rotated back, which is going to cause stress in a couple of different areas, one of which is in the very low back where the bottom two vertebrae are going to be rotated as well. And that's going to cause stress and wear and tear. At the same time, it's going to cause asymmetry in movement, which means that one side of the body in the lower portion is not going to move the same as the other side of the body. And when hips are unlevel, that means that the leg itself, one side is shorter than the other. So you're continually walking around with possibly a half-inch shorter on one side. Now, that's going to cause some twisting and angleization. Now, if the knee is a stabilizing joint, then guess what? It's creating wear and tear in that joint, eventually causing pain. So if there was a prior injury at some point in your life, with that is going to exacerbate it. And until you take the stress out of the equation, then it's going to become chronic. Now, majority of you, when you got started in the clinic, you got a home care package with these blocks in them. They're pelvic blocks or pelvic wedges. And these are very important because you can get adjusted in the office. However, if you want hips to be level, it takes a little bit of work on your part using the pelvic blocks at home. 10, 20 minutes at a time can do wonders. We need to see the hips level if we want an effective, symmetric, pain-free movement in the lower half of our body. So ask your doc. If you don't remember, give a quick preview. However, I'm just going to do a quick demonstration on how to use these. And if, let's say, the one hip is lower, let's say this hip is lower compared to my other hip, then what I'm going to do is I'm going to lay on my back and I'm going to place this on the top portion of my hip. And I'm going to lay on my back so that way gravity can take control and do its magic. The other pelvic block is going to go on the lower portion of my hips. So they're crisscrossed. And so that's effectively leveling out the hips with the pelvic there, letting gravity take its place to relax the ligaments and eventually stabilize that area. Now, this will also effectively level out the leg length as well. So now when we get up and move, we're effectively working with proper biomechanics and taking tremendous stress off that hinge joint called the knee. All right, guys, that's it for today. Love you. Talk to you soon. Bye.